patient lies still, the room filled with the sharp scent of disinfectant. Surgeons open the chest, not to remove the diseased lung, but to crush it. Into the empty cavity, they place smooth, inert objects, sometimes paraffin wax, sometimes lucite balls, sometimes even ping-pong balls. The lung collapses under the pressure, sealed off from air. This was plombage, a radical tuberculosis treatment from the early 20th century. Born of desperation in the era before antibiotics, tuberculosis, or consumption, was one of history's deadliest diseases. By the late 19th and early 20th centuries, it killed millions worldwide, with no reliable cure. Doctors believed rest was the best treatment. Rest for the body, and they reasoned, rest for the lungs. If part of the lung could be collapsed, it might give diseased tissue a chance to heal, slowing the spread of infection. The concept led to a range of collapse therapies, including artificial pneumothorax, where air was injected into the chest to deflate the lung. Plombage took the idea further, physically filling the chest cavity to keep the lung permanently compressed. The technique emerged in the 1930s and 40s, pioneered in Europe and the United States. Surgeons created a pocket between the ribs and the lung, then packed it with inert materials. Paraffin, wax, gauze, rubber sheets, lucite balls, and even ping-pong balls were used. The goal was not to remove the diseased lung, but to starve it of oxygen, forcing tuberculosis bacteria into dormancy. Patients endured long recoveries, painful scarring, and the psychological burden of carrying foreign objects inside their chest. At the time, plombage was hailed as innovative. Some patients did experience temporary improvement, especially if tuberculosis was localized. Hospitals adopted it as part of their arsenal against the disease, alongside sanatoriums, bed rest, and sunlight therapy. But the risks were immense. Foreign materials inside the chest often led to infections, abscesses, or rupture. Lucite balls could shift, puncturing tissue. Paraffin could leak. In some cases, patients developed fistulized abnormal passages that left them permanently impaired. The arrival of antibiotics in the 1940s and 50s, particularly streptomycin, transformed tuberculosis treatment. Suddenly, collapse therapy seemed brutal and obsolete. Plombage procedures declined rapidly, abandoned in favor of drug regimens that were safer, more effective, and far less invasive. Yet the legacy of plombage persisted. Some patients lived for decades with their chest cavities still filled with lucite balls or other materials, time bombs inside their bodies. Doctors occasionally discovered them during later surgeries. The history of plombage reveals both the ingenuity and the recklessness of medicine before modern treatments. It reflects how physicians, faced with incurable disease, resorted to drastic measures that often harmed as much as they helped. The sight of ping-pong balls stacked inside a human chest feels grotesque today, but it was once considered cutting-edge science. Plombage also reminds us how progress in medicine can be uneven. What seems like innovation in one decade becomes cautionary tale in the next. It's just as bloodletting lobotomies and mercury ointments were once mainstream. Plombage was a product of its time, a desperate attempt to outwit a relentless killer. Today, tuberculosis is still a global threat, but one treated with targeted antibiotics rather than collapsed lungs. For those who underwent plombage, however, the scars and complications were lifelong. Some carried their ping-pong ball implants to their graves. Strange relics of a medical experiment that speaks to both the creativity and the cruelty of pre-antibiotic medicine. The next time you see a game of table tennis, imagine the balls not bouncing across a table, but filling the chest of a tuberculosis patient. Chilling reminder of how far we've come and how far we still have to go.